To get started, please, if you can have your attention. Before I pass the baton to Jose, who will give the more official introduction to Dr. Bernera, I want to give you a little personal scoop about Michelle here. And Michelle was the Dean of the Medical School at the University of San Francisco, Quito for 12 years. And she recently passed the baton to pursue her other passions. And we got connected years ago, and she's become a wonderful friend personally and also a wonderful friend of the medical school. And it's really thanks to Dr. Brunauer that we now have a partnership with the medical school, and the first medical students from Quito are going to be coming up here this year, and we'll be sending senior medical students down there as well. But she is a fellow pediatrician, but she's does pediatric critical care and pulmonology. She's also an ethicist. She's trained and studied all over the world, in the States, in the UK, and South Africa. She's the total package, both academically and personally. And if I had a discovery year, and I spoke Spanish, there's no one with whom I'd rather work than going to Ecuador to learn from Dr. Brunauer. So I just wanted to give a little bit of a personal introduction that this is a very special VIP that we have visiting with us at the medical school today. Now I'm going to pass the baton to Jose.
Thank you very much. Good afternoon, everyone. On that same note, I would like to introduce Dr. Michelle Grenier, who has been revolutionizing or pushing the global health initiative in Latin America and really all over the world, with emphasis on critical care and a new integrated model in critical care, which is very dear to me. And as mentioned, a long-time former dean of medical school in the San Francisco de Quito. So yeah, without further ado, I can't wait to hear what you have to say.
So thank you, Jose, and thank you, Anne, for your kind words and introduction. Thank you to my dear friend Lee. He was very generous with all of what he said about me. For the beginning, I'm not a pediatrician by training. That's a mix-up, and it's because in my time where we didn't have any internet or all the global access that we have now, we did meds and peds. I know that you have the program here, but in my case, I was trained in adult critical care, but there weren't enough pediatricians into critical care. So suddenly, while I was working at the hepatic transplant unit, I had to see children. And of course, I was so scared, but this was a different time. So then I got this training in pediatric critical care. And of course, a lot of time in my life I have devoted to integrating a model of care, as Jose said, where in the ICU, we do critical care plus mental health plus palliative care that, as you know, in pediatrics, it doesn't relate to the end stage of disease, that to the diagnosis of a disease that puts a child at risk. And it can be implemented at the same time with curative care and emotional support. And as the disease progresses, then palliative care needs might progress, or as the child gets better, palliative needs might decrease. But that's the integrated model of care. And I want to thank very much to my colleagues and friends from the Global Health Department who invited me to be with here today. And I am very happy to meet you all. I was thinking about what I was going to discuss with you, and then I realized, well, it's a global health class, first-year students who did their college before, so I might talk about a project and then link it to a little bit of implementation science, just to motivate you. So I don't think that you will see anything new, but you will see some projects that were done in Ecuador and globally. as a response to the COVID-19 pandemic. So I will discuss with you the RISE project, and it's Reaching Impact Saturation and Epidemic Control in Ecuador. This is a project that started with the COVID-19 pandemic as a response to it, and it didn't start only in Ecuador, but this is a global project, as you might see, funded by the United States, by USAID, targeting low resource settings and low resource countries that really need that support. This is a project that's implemented by JPIGO, and JPIGO is affiliated to Johns Hopkins University. So in my case, during this project, I was the country director from JPIGO in Ecuador. And now that our project ended, I am the lead technical clinical advisor in oxygen globally for JPIGO. And as Lee said, I continue to work in my university as an associate dean of the medical school. I'd like to welcome you all to Ecuador. I hope that I can meet you and host you there at some time. So I'll get started. Let me just here. Great. So these are the countries that are supported by the RISE project in different levels. So in some, it's more strengthening the oxygen ecosystem. In others, it's vaccination rollout. In others, we combine HIV prevention, intervention, plus COVID-19. So as you see, the approach is very, very broad. And in this map, I didn't include Guatemala, that's also in Central America, part of Latin America, because here we're focusing just on RISE countries. But when we get to oxygen, Guatemala will be included with funding from the CDC. So during this class with you, I'm going to focus on Ecuador basically, and a little bit in other countries. And I will discuss how we supported the vaccination against COVID-19 in my country and how we supported the Ministry of Public Health, how we were able to develop the area in genome sequencing through our microbiology laboratory in Ecuador. And these are some things that seem to be, they are day-to-day things, but not for us, and not for many, many countries who do not have the means, the equipment, or the trained persons to do genome sequencing. As now, Ecuador is the second country to do genome sequencing of SARS-CoV-2 when the pandemic started. And we have mapped all the provinces in the country until today, so that we know what is circulating and we can act regarding the different strains that we have. I will also discuss how we worked in the development of rehabilitation clinics for post-COVID-19 conditions, and how we are pioneers in that in Latin America. And finally, a little bit of strengthening the oxygen ecosystem globally. Here you will see what our countries and what we need to do. So these are the highlands. We have different areas in Ecuador. And here we have this small girl because she's small because she's undernourished. We have undernourishment in Ecuador. We have huge inequality. We have extreme wellness. We have extreme poverty living aside as in many, many countries. And then we have the animal non-human health that needs to be considered. So here you will see exactly the same. This is the dog and all the puppies, and they look nourished. You don't need to study medicine or veterinary medicine to look at this. And here we are in a very, very high altitude in the mountains in Ecuador. So access to care, opportunities to care are limited in my country. And I always remember this when I think in the holistic implementation of health as a One Health approach. I think that that's important. That's our future, taking care of our environment, of animals, non-humans and of humans, and putting them in the same priority. And remember that I am a critical care physician by training. So I did pulmonology, then critical care, and I love seeing patients. But I think that we also have this responsibility that brings you to this class to think broadly and to think how we can affect in all the determinants of health that go from the individual up to the environment. And that we do have a role from our areas to be responsible for providing a positive impact to our world. So starting with vaccination strategy, when we started RISE, we had about 57% of our population that had received 1 dose against COVID-19 vaccine. And we had areas that we knew for sure that wouldn't get access to vaccination. These were areas with very difficult geographical access. These were patients that were living in poverty, or not patients, but the population living in poverty, the population in movement, migrants, population with disability or with chronic illness that wouldn't have easy access to health centers. So we decided that that was the population that we wanted to prioritize, vulnerable population in Ecuador. So the first thing was community prioritization. I will tell you more about that later on. And then we had very difficult challenges regarding logistics, because we need to think that Ecuador is a multi-diverse country, multi-ethnic population. We're very proud of our multi-ethnic population. That means that we have first languages that are not Spanish. And we need to adapt our strategies to the cultural and to different contexts. So that's something that was difficult, thinking about logistics, because it's not that you can go from the city speaking Spanish and go to a community where people are speaking Quechua and Spanish is their second language. So we needed to find health promoters, health providers. We needed to find healers. We needed to find the healers that are called yachas, so that they are natural leaders of the community, and get to explain them why we thought the vaccine was important and respect their points of view, and develop strong communication campaigns and targeted communication campaigns to identify myths regarding to vaccination and to work on those myths. And of course, autonomy prevails. So the population will decide if they want it or not, the vaccine. Thinking about logistics, something that happened, like an anecdote, because I think that this class, it should motivate you. You know, you're going to learn everything that you know in these 4 years in med school. So you need is to be motivated by people that are old and that can tell you, I'm still in love with medicine. So I think that this experience is so funny. We were traveling to the Ecuadorian Amazon, to the rainforest, to this very small village. We had to walk with boots. You know, it was like 8 hours of walking. Then we had to get a canoe, 4 hours in canoe just to reach the community. So we needed to place all the logistics in advance and let them know that we were going. And when we arrived, after all this tremendous strategic planning, you know, we couldn't vaccinate one single person. They were drunk. They were so happy because we were going to the community. We were bringing vaccine. We were going to take care of them, that they went partying. That's their culture. And then alcohol got a component of that partying, and everyone was drunk. It was a small community, so we couldn't vaccinate them. So we needed to go back and then return in another day. So thinking about context and thinking about culture is very important. And then, of course, trying to build strong models of monitoring and evaluation to see if what you're doing is working and to what extent it is impactful. So regarding the community prioritization, as I was telling you, we wanted to define neighborhoods, cantons, parish, and provinces that had low vaccination rates. So for this, we use georeferencing tools. We used ArcGIS, as you see here, and we were able to locate every community, every neighborhood, and share the data with the Ministry of Public Health. We even donated the platforms for the Ministry of Public Health. We used map visualization. We developed vaccination dashboards that will support us in decision making. So this was very important for us to use resources well, because every cent that comes to you and that is not yours needs to be used appropriately. So in order to decide well, this was one of the tools that were really helpful for us. And we could map all the different provinces with georeferencing. Thinking about logistics, and as I was telling you before, here we are hiking. We needed to hike the mountains. These communities, the communities that live here, they are 2,800 meters above the sea level. That'll be about 13,000 feet if I'm doing the correction, you know, if I'm using the formula in a correct way, it's more than 13,000 feet above the sea level. So we were the Spinake. And I love this photograph because here we can see two health providers from RISE. He's a medical anthropologist that you will get to know if you come to Ecuador. He was my mentor too, Fernando Ortega. And then she is my graduate from the med school, because regarding logistics, what we did was, as we don't have enough health providers trained in Ecuador, and the Ministry of Public Health was overwhelmed because we had, you know, in the first wave, we had so many people dying. We had so limited beds in emergency and ICU care, for emergency and ICU care in the country. When you saw all this news about people in Ecuador dying in the streets, that was true. That was true, and that was very, very sad. So the Ministry of Public Health couldn't work with populations that were dispersed. They didn't have the people, they didn't have the resources. So it was very important to link the academy to the Ministry of Public Health efforts. So my graduates, and we have a medical school, but we do not have a nursing school. So what we did was we called all our alumni and we told them, we need to vaccinate this population. They need to have opportunity to be healthy. Because if you think about the Ecuadorian Amazon, if one people got Delta, we will have communities, entire communities dying. There wasn't any access to hospitals. In the Galapagos Islands, the health system is so fragile there that if we had people that were infected, we could have the whole islands dying. That's something that we're starting to see with avian flu at this moment that I will discuss with you later on. So we had our medical graduates, and they went vaccinated, and they didn't care if they were, you know, doctors or nurses. They just had to take the course of the World Health Organization, and that was also beautiful. The intellectual humbleness. Because it's not because we were trained as doctors that we were going to vaccinate our population. We take the programs, we take the courses, we knew the how to vaccinate again, because that's something that we don't do anymore because the nurses are do that. So that was also beautiful, working in an interdisciplinary way. Something that you do not have here is hierarchy between nurses and physicians in Ecuador. That's so difficult. Physicians will say what needs to be done and nurses will obey. And that is terrible. And that's something that we can really learn from you and that we're trying to change. And it's working as a team and having different disciplines and all have the same value, because all of them take into care the best interest of your patients. So that's something that we need to change. And we started doing that with RISE and through the training of health providers in other areas. Like, for example, in oxygen, we said we're going to train, but only if we train multidisciplinary teams. If we have nurses, doctors, and respiratory therapists or therapists, we have very few in Ecuador. If we're not training teams, we don't want to do that. Because initially, the Ministry of Public Health wanted us to train only doctors. So we said we're not doing that. And that's how we started changing this concept and this relationship within members of the team. So regarding the logistics, here you will see the team hiking. Here you will see how we went in canoes. Here are the vaccines. Here are the vaccines. And then we even needed these aircraft, these simple aircrafts to get to the Ecuadorian Amazon in some communities. And mostly it was the boots and the rain. And she might be coming. That's why I put her in the photograph. She's Maria Jose Jaramillo, Majo, and she's a medical graduate of us. And she met our team here. So she might be coming and you might be meeting Majo. She's at the moment of taking her steps and her tests. So what we did was establish very strong private, public, and academic alliances. The Ministry of Public Health had the vaccines, but they didn't have syringes, alcohol, or cotton. So the private industry and companies, they provided syringes, cotton, alcohol. And then the academy, what did we do? We designed interventions. We had the force of our medical graduates that were there vaccinating. So this alliance supported us to be able to scale fast. We empowered local health providers, as I told you before, so that they could work in their own context. They were leaders in their communities, and they decided which interventions were needed to be done. They decided about their budget. We didn't impose anything. When you think on global health, and please correct me if I'm wrong, whenever you think on a project and you develop the project and then you go to the country and you want to impose the project, that will fail. We never impose anything. We co-create. We co-develop. And basically, we are facilitators for what the people on their country know, have lived, and own. So that's what we did. And that's how, for example, we knew the day in which we had to go to that community in the rainforest. The problem was that we didn't think that they were going to have this huge party. But isn't it beautiful? They had the party because we were going. So we were very happy to go again. But that's how we worked, and that's how our strategy worked. And then we had real-time data collections and updated weekly validations. So in order to gather the data and to see how many people we had vaccinated, we would use Qualtrics and include the data, the everyday data, so we could see that online. But at the same time, there was a platform of the Ministry of Public Health that we also included data in that platform. But we had an open chat of communication through WhatsApp. And I know that there are so many cons in using WhatsApp, like even in critical care, we use WhatsApp a lot. And it's not right because of confidentiality issues, like you shouldn't receive the x-ray of your patient and see that the patient improved or got worse and all the ventilatory parameters. However, when you think about an under-researched setting where there are so many few critical care physicians, you will have physicians from different provinces who ask you, and they need to be supported because they do not have all the training. They are not specialists in the area. Their units, they do not have high-frequency ventilation, for example. They have high flow, and they are not quite, they do not know quite well how to use it. So yeah, that happens in my country. WhatsApp is something that we use. And through WhatsApp, we were in communication every day, every night, during the week with 18 provinces. So you can imagine the huge amount of people that were chatting and writing. But at the same time, we could resolve things very fast. If there were needs and we identified the needs, we would resolve them. And it came from today we didn't get any Pfizer vaccine, and all the people that needed Pfizer, because the government will define the different vaccines and who will get one or the other, they were vaccinated. So at that moment, we needed to call the Minister of Public Health and tell him, you know, they didn't send Pfizer to this health center, and people are there and they are waiting. And then things were done and Pfizer arrived. Up to there's an earthquake in Esmeraldas and part of the hospital went down. We need to take and we need to mobilize our teams and bring them back and bring them safe. So WhatsApp was helpful, and it's a free, also a free platform. So yes, we use that too. And of course, we created the safe spaces through the chats where everyone had a voice, and where members of the community felt that they could lead change. And that was also great because they took ownership of what they were doing. So that regarding logistics, and then in vaccination rollout in a very limited time. And we're so proud of this because think about its vulnerable populations. It's not massive vaccination sites in the middle of the capital of Ecuador. We were able to support almost 2 million total doses of vaccines against COVID-19 in Ecuador for our population. And while here you have all the doses that we supported in 18 provinces in Ecuador. But something that was fantastic is that we were able to negotiate with USAID and with the Ministry of Public Health, because if you have funds for COVID-19 vaccine, it's not that you can go and vaccinate the population against diphtheria or Hep B. It has to be COVID-19. So we were able to negotiate with USAID and with the Ministry of Public Health for supporting the vaccination scheme in pediatrics. So we were able to decrease the gap of a vaccination scheme in children. And this was important because there was delay in vaccination because of confinement, and also because of the government didn't buy the vaccines. And when they finally got them, they were going to expire. Please. About 15 minutes. Yes, okay. 15 minutes and we finish the class? Great. 15 minutes is more than enough for me. So what we did the most was work with mobile brigades. So if you see that the number of mobile brigades is impressive, these were the ones that were walking. And these are the ones in red. And when you see the dark brown, these are the areas of the most reduced accessibility in Ecuador, the geographic areas of reduced accessibility. So this is what we did regarding vaccination. The rollout, we had those vaccines that were approved by the World Health Organization. Those were the ones that we supported. And here are all the provinces that we supported. We identified that the people living with HIV were not having access to vaccination, and that there was a higher gap within this community than with the people that didn't have HIV. And the thing was that they were being led to go to health centers, and they do have their units of care. And the problem was that if they went to health centers, they had to ask for permission at their jobs and lose more days of work. They didn't know the health providers at the health centers. They were very worried about stigma, about breaking their diagnosis. So what we did, and look how easy it was, we started with vaccination points in their health units of care. So whenever they got to receive their medication, they were vaccinated. So we were happy because we were able to close the gap in several provinces, in the highlands and also in the coast. Regarding our health education campaign, we work with infographics, with prevention and promotion messaging, And these bags are beautiful because these were done basically by women that were health providers for their family, breadwinners during the economic recession. And this had messaging regarding health promotion and prevention, and not specifically related to COVID-19, but to all. It's yo me cuido y me vacuno. I vaccinate myself and I take care of myself. So when COVID is over, that wouldn't be, when they see the bags, they are not going to think about COVID. They are going to think about everything related to health. And as we bought the bags from there, they received that money. Children received also these notebooks for studying schools. We did jingles for community radios where there isn't social media in rural areas. And we were able to reach about 31,000 people that were trained in COVID-19 vaccine-related topics, and more than 510,000 people were received messages through social media, etc. And there's this jingle that we did that was so catchy, but I don't know how to, if I can put it now so that you can see. Yeah, it's not, no, it's not hearing. Don't worry. And then what I wanted was for you to see very briefly in 4 minutes, do not mind about the music, but that's my country. So that is Ecuador.
Con Proyecto RISE hemos podido vacunar a 1.850.000 personas de situación de vulnerabilidad en 16 provincias del país. Nuestra fuerte han sido las brigadas móviles. Hemos podido desplazarnos a lugares de muy difícil acceso geográfico. Y hemos podido apoyar la estrategia nacional de vacunación desde el niño hasta el adulto mayor a lo largo de todo el espectro de la vida.
Y a través de RISE llegamos a muchos lugares rurales donde nunca antes han sido atendidos sobre brigadas médicas. También ahí se dio esquema de vacunación.
El objetivo fue vacunar entre el 60 a 80% de la población y lo hemos cumplido.
El objetivo del proyecto RISE siempre ha sido concientizar, educar y sobre todo promocionar la vacunación contra el COVID.
Vamos a hablar de cómo se debe utilizar la mascarilla, ¿sí? La población puede entender que la vacuna es muy importante dentro de tu proceso de vida, ya que garantiza protegerte de los diferentes tipos de virus que podemos tener.
Hemos podido aprender las altas necesidades que tienen dentro del país nuestra población, las diferentes barreras de acceso a salud, las barreras sociales, las barreras culturales y toda la ayuda que se necesita para que la gente pueda acceder realmente a todos los servicios de salud, uno de ellos siendo importante y vital la vacunación.
El financiamiento de USAID ha sido fundamental para que logremos conseguir estos objetivos. Y a través de la implementación de JPIGO, con una colaboración y articulación con la Academia, Universidad San Francisco de Quito, con el Ministerio de Salud Pública, sector público, con el sector privado, con la sociedad civil, vamos a continuar en la vacunación para nuestras poblaciones vulnerables en el Ecuador contra la COVID-19.
Podemos trabajar entre todos para que la salud sea accesible para la mayoría de población, sobre todo para aquella población vulnerable o que por dificultades económicas y sociales no puede acceder con facilidad a la vacuna.
Y el proyecto RISE nos ha brindado apoyo tanto con los viáticos, la movilización y todos los implementos y equipos de protección que nosotros utilizamos.
Entonces, gracias a RISE, una cosa de estas fue tener el transporte para poder dirigirnos a varias comunidades, varios recintos, y así llevar la vacuna a todas las personas. La vacunación para niños significa salud, bienestar,
Protección.
para mí, la vida,
Salud. Vida.
oportunidad,
Protegernos todos.
protección, salud.
Una oportunidad más de vida, protección para nosotros mismos.
La seguridad.
Salvar mi vida y la de mi familia.
Thank you. Thank you. Do I have 2 minutes? 2 minutes? So thank you so much. I hope you enjoyed the video. But thinking about genome sequencing, let me just, sorry about that. No. Thinking about genome sequencing, we were able to support Universidad San Francisco de Quito, USFQ, and the Department of Microbiology with more than 1,700 samples from all over the country to identify the lineage of SARS-CoV-2. And thinking about One Health, we identified in the brown-head spider monkeys that were in a wildlife rescue center that they had COVID-19. And the transmission probably was from a human, the caregivers, to the monkeys. So this is something that we did and that we were in the process of publishing. Now we're working in genome sequencing in avian flu, as I told you before, in different provinces. So this is not only Galapagos, this is also Puerto López, Esmeraldas, and in poultry for food for the population. Thinking about the post-COVID-19 clinics that I was telling you about, we were pioneers in Latin America in developing clinics for the rehabilitation of post-COVID-19 condition, but we didn't have any respiratory rehabilitation in the country, none. So we used this as an opportunity to strengthen respiratory rehabilitation in the country, even though we know that post-COVID-19 rehabilitation is multidisciplinary. So we focus on a multidisciplinary model, but we donated equipment for respiratory rehabilitation that we didn't have. We developed evidence-based guidelines that were adopted by the Ministry of Public Health, a mobile lab called Respira that you can find in iOS or in iPhone. And then Jose, that pronounced with that brilliant Spanish, you might want to suggest this app for your patients. This under supervision can be used for domiciliary rehabilitation. So that's very important for us because we don't have the infrastructure to receive all patients. And here the donation of the equipment. Something that is interesting is that in these 21 clinics in 7 provinces, we were able to support the care of more than 12,000 people. And from these, 653 had criteria for post-COVID-19 conditions. And many of them were young. They were on the university, they were working, and they got this disease with severe functionality alterations. So this needs to be taken into consideration, and rehabilitation is important in post-COVID-19 conditions. And then just briefly to finish, thinking about strengthening the oxygen ecosystem, the RISE project supported Ecuador in so many areas. Infrastructure, we got the cryogenic tank, LOX donation, we got liquid oxygen, capacity development. We trained so many health providers in the use of oxygen and evidence-based use of oxygen. We implemented quality assurance programs. And what we realized is that we take oxygen for granted, and this is a medication. And we didn't have this medication in many provinces. And many countries do not have oxygen. There are countries in which from four children, 2 to 3 will die without having had access to oxygen when they were critically ill. So the pandemic brought awareness of this, and funds started to come to build PSA oxygen production plants, to get donations of liquid oxygen, and to try to bring oxygen to different countries. I am working in strengthening the oxygen ecosystem globally. And I was so impressed because in Ecuador, we do not have oxygen in some places, but since I was born, I know what oxygen is. It's not new for me. But working, for example, in Sierra Leone now, we had the first training regarding use of oxygen because they received their donation of a PSA plant. It was so fantastic, and I couldn't imagine people that were afraid to get close to a cylinder because they were scared that it will explode. And you know, having them had this access and this opportunity to get oxygen, this was amazing. This was fantastic. So these are the countries where we are strengthening the oxygen ecosystem now. And during these years, since the beginning of the pandemics until now, we have supported more than 1,000 facilities with PSA production plants. We will have trained more than 20,000 health professionals in the use of oxygen, have supported more than 400 facilities with liquid oxygen, and the overall number of facilities that we have supported to strengthen the oxygen ecosystem are more than 4,000. These are our 12 countries, and unfortunately, as the pandemic mood is going down, then the funds for oxygen are also decreasing, and we're closing now our projects regarding oxygen. So remember, when we think about pandemic preparedness and global health security, oxygen needs to be taken in mind. So thank you so much, and I'm looking forward to have you at some point in my country. Okay, feel free to contact me.
Thank you.
Thank you. And I'll be happy to answer any question or follow up any question in I was going to say WhatsApp by email. I know you have another class, so
Thank you.
yeah,
Michelle, for such
thank
an
you.
inspiring presentation. Such
Okay.
an amazing
Gracias.
role model. Go for it.
Gracias, Lee. Thank you, Lee. Thank you very much.